In today's Research to Practice, we're going to talk about an article titled Spoken Language Outcomes in Limited Language Preschoolers with Autism, a randomized control trial of early intervention approaches. In this study, they looked at preschoolers who have a very limited language. So these are the kids who are not yet speak in sentences and may be able to say single word, but most of the time we're looking at children who cannot communicate very well. And an outcome in this study is the expressive language. So they're looking at if a kid came into the intervention who had a lot of self-injury behavior, who could not talk much, maybe can use single word, say milk or water or open, or even does not have any language. After a period of intervention, say 6 months, do we see a difference in a child's spoken language? This intervention lasted about 6 months, and they also followed up 6 months after the intervention is over to see whether the things kids learned maintained over time. So the study looked at 2 interventions. They're trying to compare the effectiveness of 2 interventions. Both interventions are very common in treatment for children with autism. The first one is not very foreign to many parents, and if your child is in the ABA clinic, this probably is the intervention your child is receiving. The instructional method is called discrete trial training, where this is very structured and very adult-led intervention. And also it's in a very controlled setting. Maybe have a table in the room, there is very limited stuff in that room, and then say the child is learning labeling things. Maybe the clinician will say apple, and then wait for your child to label apple using vocal imitation. The clinician may take a look at the task your child needs to learn and break down the task, and then very systematically teach those tasks one by one. So this is what we call discrete trial training in applied behavior analysis. And note that DTT is not applied behavior analysis, it's one of the methods using applied behavior science. The other method is called JASPER. It's a mouthful. It's called Joint Attention, Symbolic Play, Engagement, and Regulation, JASPER. This is one of the approach known as naturalistic developmental behavior intervention. So it kind of marrying the applied behavior science, the behavior approach, with the developmental science. So in JASPER, what you will say is what you will see is less of structured. A child sit at a table and highly adult-led, and on the contrary, it's very child-led. In JASPER, we talk a lot about following the child lead. Talk a lot about your role is to support your child play, and you are not asking the child to play a certain way. You are not constantly asking the child questions during the play. You are follow the child lead, meaning if your child is interested in a car and then you just say, oh, that's a red car. And you kind of know, okay, if my child is using single word, I'm gonna model the language using maybe 2 or 3 words. And if your child is stuck and you start to expand the play saying, oh, the car can go zoom, 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 and you are modeling that play for your child. The idea is using the play as a context, using the routine as a context to teach your child language, to teach your child joint attention, to teach your child play. So that's what they did. They randomized the kids into 2 groups. One received DTT, one received JASPER, the naturalistic developmental behavior intervention. And after 6 months, this is what they found. And they found that there's really no group difference between the 2 interventions. And both groups made a lot of progress in spoken language. And when you compare the 2 groups, really, they're about the same. In terms of joint attention, they found that if your child has some joint attention to start with, and then your child responds to the gesture much better, right? This is actually not surprising because you already have some prerequisite skill, and then the interventionist can build upon that. So what's the takeaway message? Well, the takeaway message is what matters is that the intervention is systematic, and then you can implement the intervention with a lot of fidelity. What I mean by that, if you implement imitation program and then you put down a schedule, say 5 for 15 minutes, you start with that, following the PC system, and you need to do that consistently. And you need to take the data consistently so that you know where your child level is, and you can individualize that intervention for your child. And also you select the goal very carefully and then do a thorough assessment of your child, receptive language, joint attention, so you know what appropriate target is for your child. The take-home message is that children who are very limited in spoken language, often who also have a lot of challenging behavior, they can make progress in developmental spoken language outcome. They can make progress in number of words they can speak after 6 months of intervention if they are using evidence-based practice. This can be DTT or Jasper. Not just that kids can make progress in spoken language, they make a lot of progress. So in this study, they found out with over 30% of children start to use sentences and phrases after the intervention. One of the future direction of autism research is really trying to figure out how do we match kids to different interventions. So in this study, it was really clear that both the DTT and Jasper work. The next question is, which kid would be a better candidate for DTT? Which kid will be a better candidate for Jasper? Thank you for joining today's episode on Research to Practice. We talk about early interventions for preschoolers with a very limited language, and I'll see you next episode.